Hello, good afternoon, teachers and staff of Leganes National High School. This afternoon, we will be taking or tackling blended hugs, helping other through psychological first aid. This is very important for us, especially during this COVID-19 pandemic, to look for our mental health. So before I will proceed for my slides. Okay, so before I proceed, I would like to thank PGCA, Philippine Guidance and Counseling Association, especially to my colleague in DepEd, Mr. Francis Ray Subong, RGC. Thank you very much, sir, for this information about my webinar. Okay, so we have here the friendly reminders for everyone. Please mute your microphones all the time as not to distract the speaker and the participants. Please type in your question later, and this webinar is recorded for documentation purposes. So at the end of the webinar, the participants are able to understand the different concepts in the provision of mental health psychosocial support, differentiate the possible strategies in the provisions of mental health psychosocial support, and appreciate the importance and limitation of psychological first aid. So these are the objectives. So let me ask a question to all of you. How do you feel today? Are you happy? Are you confused? Or are you nervous or anxious or anything? You can comment in the chat box. Okay, so list down emotions or behavior you have experienced during this COVID-19 pandemic. This is different kinds of behavior that you feel or experience in this time of pandemic. Do you feel irritable, or are you depressed, or also avoidance to your friends, or you are poor in performance, or you have nightmares? You can comment down in the chat box. Okay, so do you know high levels of stress can negatively affect our mental and physical health? So sa sobra ka panumdum, sa sobra ka stress can affect our mental and physical health. Another problem we all know that our government is facing today is to flatten the curve. That is why we need to follow all the safety protocols in order that the virus should stop from spreading. At the same time, we are all experiencing challenge, and that challenge is our mental health. The rising mental health concern ng lahat ng tao, not only here in the Leganes or in Iloilo, but all over the world. So dahil sobrang stress natin, it can affect our mental health, and this can also be deadly. So we should take care of our mental health. So, okay. So as we all know, we have RA 11036, otherwise known as the Mental Health Act. So mental health refers to a state of well-being in which the individual realizes one's own abilities and potentials, copes adequately with the normal stresses in life. So when we say mental health, ginaisip ta nga buang na ang notion na may mental health concerns ay may problema lang sa isip. Pero hindi na siya Pero hindi na siya. So we need to erase the stigma. If we have mental health concerns, ay hambalon kita nga buang, but erase that stigma. Not all people may have a mental health concern ay kailangan po ng treatment. Iba ay kailangan ng PFA, Psychological First Aid. So, mental health services, it refers to psychosocial, psychiatric, or neurological activities and programs along the whole range of mental health support services. So, ano po ito? There is a level of mental health services. There's first phase, second phase, third, and fourth phase. So, in the lower, if you are in the lower phase or lower level, you are healthy. You need psychosocial support. And if you are in the fourth phase or mentally ill or illness, you need to have a psychiatric, neurologic, or doctor. So, mental health refers to medical doctor, psychologist, nurse, social worker, guidance counselor, or any other appropriately trained and qualified person with special skills relevant to the provision of mental health services. So, the highlighted meaning na-train po sila. Like for teacher, we need the training. We need training like INSET, to upgrade our knowledge para maparating po ang tama sa mga students natin, di ba? Okay, so what are the role of educational institution? So as we all know, all public and private educational institutions shall be required to have a complement of mental health professionals. So employers shall develop appropriate policies and programs on mental health in the workplace designed to raise awareness on mental health issues. So in order to help this deliver all these mental health services that our learners need, we have like nurses or nurse, registered guidance counselor, and dentist in our school. So we all know that our school has a unique part of mental health. So correct the stigma and discrimination associated with mental health conditions. So, i-correct po ang stigma and discrimination when it comes to mental health concern, mga illness. So, we do not underestimate the stress. Stress lang na siya. We do not know that what is happening to that person. That person may dapat tulungan, that it may lead to suicidal tendency. So, let's proceed to psychosocial support. Mental health, psychosocial support, general concepts and guidelines, and national laws and policies, and the scope of multicultural practice, meaning we give psychosocial support. We should know national laws and policies. We can't give a counseling if we are not a registered guidance counselor. And we should consider the multicultural practice of a person. For example, if we have a foreigner, or we need to be aware of the need to respect that person. At the same time, we should anchor po ito sa DepEd. In giving a psychosocial support, we cannot go beyond. So these are the normal adaptations and responses of coping responses of a person. Okay, so ano po ang normal actions? Seeking help from others or offering help to others. They talk to a friend, talking about their experience and trying to make sense of what happened. Trying to stay safe until the danger has passed. Trying to stay safe. Seeking information about the welfare of their loved ones. They may fight to survive, fight lang ng fight, take flight, takasan ang problema, or freeze but go on to adapt. So, psychosocial support is essential for maintaining physical and mental and provides an important coping mechanism for people during difficult times. So, psychosocial intervention constitute the backbone of any mental health psychosocial support response and include a range of social activities designed to foster psychological improvements such as sharing experiences, fostering and social support, awareness raising, and psychoeducation. So we have here psychological first aid. How are we able to give a psychological first aid? So we have teachers that we have teachers training for psychological first aid. So I am the chairman and the members are Ma'am Christy Leonard, math teachers, Ma'am Melba Tupas, and ESP teachers. Okay, so what are psychological first aid? It describes a humane, supportive response to a fellow human being who is suffering and who may need support. So, nagbibigay support sa mga nag-suffer ng mental health or suffer mentally. PFA aims to provide psychosocial support reflecting aims similar to those of first aid to assist people in emergency disaster situation to survive, to minimize psychological injury, and to facilitate recovery. So, if feelings, emotions, sa isip, that is already for PFA. Meaning, kaagarang lunas to help that person to be mentally well. Psychological first aid, it is a method of helping people in distress so that they may feel calm and supported to cope better with their challenges. It is a way of assisting someone to manage their situation and to make informed decisions. The basis of psychological first aid is caring about the person in distress and showing empathy. It also involves in paying attention to reactions, active listening, and if needed, practical assistance such as problem solving, help to assess basic needs, or referring to further options for assistance. So, for example, assistance would refer to a different agency. PFA helps normalize worry and emotions and also promotes healthy coping and provides feeling of safety, calming, and hope. So that is PFA. Also, PFA involves the following themes: it providing practical care and support which does not intrude, assessing needs and concerns, helping people to address basic needs, for example, food and water, information, listening to people but not pressuring them to talk, listening to comforting people and helping them to feel calm, helping people connect to information, services, and social support, protecting people from further harm. So, no pressure. All we need to do is to listen to them. So, what PFA is not. It is not something that only a professional can do. This can be a doctor or RGC, psychologist. But if you have a training for PFA, it's okay. It is not professional counseling. It is not psychological debriefing. In the PFA, does not necessarily involves a detailed discussion of the event that caused the distress. It is not asking someone to analyze what happened to them or to put time in an event in order. Although PFA involves being available to listen to people's stories, it is not about pressuring people to tell their feelings and reactions to that event. So, no, you need to listen. All you need to do is to listen, no pressure, and no debriefing. So we have here core action principles: look, listen, and link. So let's proceed to look. It refers to how to assess safety for First, always check for safety. Find those with priority needs or serious distress. So, for example, mga bata na victim of harassment or abuse that we need to protect, always check for their safety. Find those with priority needs or serious distress. The current situation, you need to consider those who seek support, sino nangangailangan ng support. And when we are giving PFA, this is always anchor with respect, and let us stop comparing them to other client or others. They also need needs of the affected, expected emotions and reaction. This is the normal thing we do. So, distress reaction to crisis. Physical symptoms like shaking, headaches, fatigue, loss of appetite, aches, and pains. Also, kung na-depress, like kung ginbayaan ka sa girlfriend or boyfriend, you lost your appetite. Anxiety, fear, weeping, grief, and sadness, guilt, shame, for having survived or for not saving others. Elation for having survived. Being on guard, jumpy, anger, and irritability. Being immobile, withdrawn, takot na disorientation, not knowing one's name, where one is from, or what happened. Inability to speak or to respond to others. Sometimes our learners don't speak. Sometimes they don't want to share or speak to us. So wag lang pilitin. Confusion. Emotionally, numbness, being in a daze or state of disbelief. Inability to care for oneself or one's children, not eating or drinking or able to make simple decisions. So, looking remotely, meaning how we help other people remotely during this pandemic, or as we can say, no face-to-face. So, there are some considerations. So, social media. May mga friends ta nga sobra, for example, makita ta sa Facebook, may mga friends kita nga sobra mag-post sa Facebook if they feel angry or sad. Ginapagawa nila through posting in social media. Sometimes, that is a negative, but that post will be that is sometimes normal, that post. Kay kung hindi nila pagpakuon sila ang ilang na feel, they may lead to depress or stress. But sometimes the negative post in social media, sometimes we are also affected, but we have always have a choice. Pwede hide. If you want to help, you can PM him or her, or ask them if kamusta na siya. If you have a friend or family member that they are discussing, or he or she is discussing about suicide or other thoughts, suicide thoughts, you should, hindi mo siya baliwalaon. You need to talk to them. You need to talk to her or him. Okay, so social exclusion or no longer response to respondents. Low work productivity, poor work output, does not submit on time, does not attend meetings. So, sa aton dire subong, mga colleagues naton, you need to look for our colleagues if may lain na sila bala na batsyagan. I mean, tumilain na gits man sa ila. Nga sa una, dasig siya mag-submit sa work, subong, doon na tamaran na siya. Okay, so next is listen. Listen refers to how to those who need support, to their concern, help them to feel calm. Listen with eyes, full attention, ears, and heart. So, okay. We need to respect. When we listen, we are not just using our ears. We also using our sense of eyes, ears, and heart. Okay, so we begin to the conversation. We introduce the helper. So no need na to introduce long. Pay attention and listen actively. Accept feelings. Calming someone in distress. Ask about needs and concern. Help find solution to needs and problems. So we have here active listening, a way of listening and responding to another person that improves mutual understanding, a structured form of listening and responding that focuses the attention on the speaker. So focus on the clients or learner. Things to say and do. Try to find a quiet place to talk and minimize outside distractions. Stay near the person, but keep an appropriate distance and depending on their age, gender, and culture. Let them know you hear them. For example, nod your head and say, be patient and calm. Provide factual information if you have it. Be honest about what you know and what you don't know. Like first of, I don't know, but I will try to find out about that for you. So, you need to be honest. Do not pretend na balaan mo ang tanan. Also give information in a way that a person can understand. Just keep it simple. Avoid the technical words. Acknowledge how they are feeling and any losses or important events they share with you, such as loss of home or death of a loved one. So you will say, I'm so sorry. Okay. Next is respect privacy. Keep that person's story confidential, especially when the disclosed is very private events. So take note, confidentiality. Confidentiality. Acknowledge the person's strengths and how they have helped themselves. So we need to acknowledge that person's strengths. Things not to say and do. So, hindi pwede. Don't pressure someone to tell their story. So, don't interrupt or rush someone's story. Di magdali. Don't give your opinions at the person's situation. Just listen. Don't touch the person if you're not sure if it is appropriate to do so. So, no for touching. Don't judge what they have or haven't done or how they are feeling. Don't say you shouldn't feel that way or you should feel lucky you survive. So, no opinionated, hindi ta maging judgmental for that. Don't make up things you don't know. Don't use too technical terms. So, simple words that a person can understand. Don't tell someone else's story. Don't talk about your own troubles. So, don't give false promises or self-reassurance. Don't feel you have to try to solve all the person's problems for them. Don't take away the person's strength and sense of being able to care for themselves. Hindi ta mag-solve sa ang problema. We are there to assist them. We are there to listen to them. The consideration for remote PFA. Empathy and warmth, attention and affirmation, acceptance, safety, asking the right questions. Be aware that it's normal to react with anger, frustration, or confusion when experiencing adversity. Remote PFA, you need to introduce yourself. Ask how can be of help. Agree on the duration of the call. For example, ma'am, sir, remind ko lang, we have a 15 to 20 minutes call. Dapat may lista ka mo sa mga questions, kung ano i-questions mo sa iya. We can give more time for them, at least may agreement ka mo. So, need to follow up. Ask about coping, self-care, and stress management. Ask what the caller will choose to do and assist the caller to find out things they can do or suggest they write a list of inspiration. So, link refers to how to assist with people to basic needs and services, to information to their loved ones, to further support. Assessing information. For example, during enrollment, may mga parents nga nagpamangkot, connecting with loved ones and support and social support, tackling practical problems, assessing service, and other help. Okay, so consideration refer to specialized help if a caller has not been able to sleep for the last week and is confused and disoriented. It is so distressed that they are unable to function normally and care for themselves or their children. For example, not eating or keeping clean, losses control over their behavior, and behaves in an unpredictable or destructive manner. Also threatens harm to themselves or others. Starts excessive and out of the ordinary use of drugs or alcohol, or living with psychological disorder, and or were taking medication prior to the situation of distress, may also need to continued mental health support, present chronic health conditions, and need more supports, present symptoms of severe mental health conditions, is experiencing violence, or is being sexually abused in any way. So, link. Refer, ask if there any practical problem or challenges. Refer to other services if needed. And the conversation summarizes the conversation by highlighting key issues discussed and the reaction points identified. Agree on a follow-up if possible, and end the call by thanking the conversation. So, these are the professional behavior in delivering PFA. Operate only within the framework of an authorized disaster response system. Model healthy responses, calm, courteous, organize, helpful, be visible and available, maintain confidentiality for the safety, remain with the scope and expertise and designated role. Doon lang tayo sa mga nalalaman natin. Make appropriate referrals. Be knowledgeable and sensitive or culture and diversity. Pay attention to your own emotional and physical reaction. Practice self-care. We can go beyond. Doon po tayo sa ating framework. Don'ts in delivering PFA. Do not make assumptions about what the survivors are experiencing or what they have gone through. Do not generalize. Do not assume that everyone exposed to a disaster will be traumatized. Do not pathologize. Do not label reactions as symptoms. Do not talk down to or patronize the survivor or focus on his helpless or weakness, mistakes, disability. Focus on what he has done effectively to others. So, do not generalize. Example, lahat ng COVID ay may trauma, may mga coping skills rin sila. So, you need to not to generalize. Do not assume that all survivors want to talk or need to talk to you. Being physically present in a supportive, calm ways helps survivors feel safer and more able to cope. Do not debrief by asking details of what happened. So, hintayin natin mag-approach sila or mga isla bulig kung kaya man lang mag-cope up. Sometimes okay man sila. So, do not debrief by asking details of what happened. Do not speculate or offer possibly inaccurate information. Know the facts before answering the question. So, okay, so our reaction to COVID-19 pandemic are normal reactions to abnormal situations. So, that's the end of our topic. I hope that this will help us, especially during this time of pandemic. Thank you very much for listening to my talk. And I hope that we will work hand in hand in this incoming opening of class.